We have now come to the highly anticipated moment of this evening. I'm delighted to invite Dr. Duminda Samarasinghe to join us for the prestigious induction as President of the Sri Lanka College of Paediatricians for the term 2024-2025. I'm certain that the members have high expectations of you, having witnessed your tremendous efforts and achievements in the field of pediatric cardiology. Sir, now I cordially invite you to address the gathering.
Immediate past President of the Sri Lanka College of Paediatricians, Dr. Kosala Karunaratne, members of the Board of Trustees, past presidents, council members, members of the Sri Lanka College of Paediatricians, all distinguished invitees, ladies and gentlemen. At the outset, I should thank all the members, past presidents, and everybody for having trust in me as the president of this esteemed college for the period of next year. I think it is an honor. I consider it as an honor and a privilege to be the president of this august college. Right at the beginning, I should congratulate the Council of the Sri Lanka College of Paediatricians 2023-2024, the marvelous job done over the past 1 year. It was a difficult time, but Kosala, with all his members in the council, did a fantastic job and completed another very successful year in the College of Pediatrics. College of Pediatrics was not the College of Pediatrics in 1953. It started as Ceylon Pediatric Association with Dr. Ello Aberatna as the founder president in 1953. It gradually expanded over the years, and in 1996, it became the Sri Lanka College of Paediatricians, and the founder president was Dr. B.J.C. Perra. In this esteemed college, for the year of 2024-2025, I have selected the theme, Organize and Collaborate for Cost-Effective and Meaningful Care. A theme doesn't become a reality unless it is converted into a mission. The mission for next year is Organize and Collaborate to achieve a change in practice towards cost-effective and meaningful care to save and protect the children of Sri Lanka. So over the next 20 minutes, my task is to explain what this mission is and what we are going to do. Save and protect. Why do I say save and protect? I started my career as a medical officer of health, MOH, medical officer of health at Varakapala Hospital in the preventive sector, not as a medical officer in the curative sector. So when we started with that background, when we started the Till Parade in 2016 to raise funds, at that time the cost of Little Hearts project was 2.2 billion. We thought we have to go to every segment in the society, so we reached children. There was much criticism about taking money from children. But we did it with a purpose. What did we do? We asked children to protect their good heart while helping to save a broken heart. Why did we say so? Because prevention is equally or more important than cure. Because unless we emphasize on preventive services, even if you spend the whole health budget on curative services, that won't be adequate. Or in fact, the whole Sri Lankan budget will not be adequate unless we emphasize on what these midwives do by going home to home and preventing the diseases that would have come to a hospital. So that is why we will be emphasizing on preventive services. That is why I have included save and protect. So what is the meaning of meaningful care? I'll take an example from my own practice. My job is to close hole in the hearts, to simplify. So when you close a hole in the heart, first thing is that heart should benefit. So that is why we don't close small holes in the hearts, because heart will not even feel it, that we have closed a hole. So that heart belongs to a child, and the child should benefit. Child should feel better. He should be more active. That child belongs to a family, and the family should benefit. That family belongs to a society, the society should benefit. Why does the society should benefit? Because in government hospitals, the society spends for the procedure. So when we close a hole, the society should benefit. That is what I meant by meaningful care. So meaningful care means not treating a lesion or a disease or just prolonging life. It has to be treating a child and a family and giving back a healthier child to the society. So whatever we will be doing during next year, we will have this in the back of our minds. To be meaningful, one of the main things that you need to do is to make it cost effective. So what is the yardstick? What is the benchmark for cost effectiveness? Can we provide the same healthcare facilities that are provided in the West in a developing country like ours? What is the benchmark? For each a quality adjusted life here, if you do an intervention in the USA and spend $50,000 on an intervention, and if it provides 1 year of quality life, that is considered as cost effective for USA. For UK, it is £20,000, and what is it for Sri Lanka? According to WHO definition, cost effective of an intervention, if it is less than the per capita GDP per quality achieved, that is 1 year of healthy life, it is very cost effective. If it is between 1 to 3 times the per capita GDP, it is considered effective. So what is our per capita GDP? According to the figures of the central bank, our per capita GDP is $3,830, that comes to 1.2 million. So whenever we do a procedure, we have to think whether we are doing something cost effective. So even with cost effectiveness, can we treat all children with our limited resources? Cost effectiveness enables us to treat more children with the same resources available, same amount of money available. We can treat more children if you are more cost effective. But still, if you can't reach the target population, we have to prioritize. There are different methods to prioritize. Lottery, first come, first served. Sickest first, youngest first, number of lives saved, prognosis of life years saved, instrumental value, reciprocity. There are so many things. But none of them are perfect. So you have to prioritize based on the big picture. So we did some discussions and decided what are the areas that can affect a safe and sound childhood. You can categorize it in many ways, but we have decided to categorize them in different locations that a child can be and be exposed to a hazard. It can be home, school, healthcare, or society, at a healthcare facility or in the society. So there are numerous aspects to look into, the big picture. When you take the big picture, there are numerous aspects to look into. Why should we do this? Because then only we can identify the most cost-effective interventions that we can do. So when you are optimizing limited resources, we should prioritize based on scientific justification. That is why I said we have to be cost-effective. Our target is to achieve a change in practice. In my experience, that is the most difficult task, change in practice. Why do we need a change in practice? Are we cost effective? Is our care meaningful? Are they always beneficial? Our practices, if you analyze, can be beneficial, can be doubtful, or can be even harmful. You might not agree that we have harmful practices as well. I'll take a simple example from my own field, giving oxygen to a child with a shunt lesion or a ventricular septal defect or a hole in the heart. What happens when you give oxygen? It will increase the flow to the lungs. Do we do it? Yes. Is it harmful? Yes. Is it due to lack of knowledge that we do these wrong things? Maybe. When I ask, will you change the practice, it's a question mark. There is always resistance to change. When the wheel was invented also, people have rejected it. They said, no thanks, we are too busy to change. Because the change process, the ultimate goal is to increase the performance over a period of time. From old status quo, there will be some foreign element which will induce the change, and over a period of time, you will reach a new status quo. If it is simple as this, everybody will change. But it is not as simple as this. In between, there is a dip. There is resistance, there is chaos, there is transforming ideas, then only there is integration and new status quo. That is why people don't change. They are very happy with the way they handle things. So how do we change? Nelson Mandela said, education is the most important tool we can use to change the world. But is our education driven to change a practice? We want to learn the latest, we forget about the basics. We want to learn everything, our trainees want to learn everything, and ultimately we end up without knowing anything. We want to be jacks of all trades, and we end up with masters of none. When we plan educational activities, do we identify the gaps? Do we target a practice change? When we deliver these educational activities, do we consider cost effectiveness? Do we consider the human capacity to handle? Because everybody says that you can concentrate for only 20 minutes at a stretch. But our programs run from 8 a.m. to 4 p.m. And do we do a post-event evaluation? Do we see whether actually there is a change in practice? I'll take a simple example from my life. I was the president at Sri Lanka Heart Association in 2019. We did a conference. Conference package offered by the hotel was, at that time, 2019, 4,800 net per person per day. Total cost we spent was approximately 20 million in 2019. So if there were about 500 participants, when you divide this 20 million by 500 participants, cost per participant for 2 days comes to about 40,000 rupees. We are organizing the conference in 2025 for the Sri Lanka College of Paediatricians. Conference package has gone up to 10,000 net per person per day. Projected expenditure will be somewhere around 40 million. Cost per participant will be about 80,000 for 2 days. I'm not going to say anything beyond that. During next 1 year, please, all the members at each level, subspecialty, at unit level, please identify 3 inappropriate practices in your unit or in your field. Change the practice and say it aloud. When you say it aloud, there will be a snowballing effect, others will follow. Because change always has a snowballing effect. So that is change in practice. I can't do everything alone. That is why I need to collaborate. Collaborate with everyone. First, you have to collaborate with your home members, that is the membership. Other professional colleges, Ministry of Health, NGOs are some to name a few. There are thousands, hundreds, I would say, to collaborate. Because without collaborating, we will not be able to achieve anything. Before you start collaborating, you have to organize yourself. So how do we organize ourselves? Our plan for SLCP 2024-2025. We will first organize ourselves. We have started developing a database where it will include everything: membership, councils, details of membership, details of councils for different years, committees and activities, letters, SOPs, bylaws, awards of scholarships, project reports, sponsors, inventory purchasing, you name it, everything will be there in the database. So it will be just a click of a button. We will try to change to be better, at least by a little bit, over the next year. We will target a change always more appropriate, more cost-effective, with a less carbon footprint. That is the goal. Every change should fulfill at least these 3. So the change has already started. That is why you are here. I searched the word induction. In the Merriam-Webster dictionary, it says, the process of an instance of being formally placed in an office or an organization. The example they take is the formal induction will be tomorrow, but the college president has already started the work. Certain colleges don't have an induction at all. Certain colleges have the induction after about 1 or 2 months from the AGM. Certain colleges, I did a ground analysis. Certain colleges have induction with their inauguration at the last minute. If you are officially inducted, why not have the ceremony also on the same day? That was my theory, and that is why you are here today. But when you make a change, can you satisfy everybody? You have to see the ground reality. Understand the reality. We are in a Gaussian curve. So when you are in a Gaussian curve, 50% of the population, if it is a normal distribution, 50% will say yes, 50% will say no. But it is not an issue for a majority in the minus 2 SD to plus 2 SD. They will take anything. For them, it is not an issue. But the people at the extremities will speak. For and against, both. And remember that they have the loudest voice. Curve will shift depending on arguments as well as the general understanding and intelligence of the population. With my basic analysis, I think the curve has shifted towards a thumbs up. That is what I understand. The history will tell you. When we see this news, former British PM Boris Johnson travels by train, carries his own luggage and backpack. We all appreciate it. We appreciate simplicity. We say our politicians should follow the same. But when it comes to actual practice, do we practice what we appreciate? Is the question. So, ladies and gentlemen, for next year, we will try to change. We know that there will be chaos, there will be resistance and everything, but we will try to change to be at least by a little bit. To do that, we need to first identify the gaps, and we need to prioritize. On broader terms, our key areas to concentrate is basically delivery of knowledge, obviously, as a college, how to deliver it, and the infrastructure to do the delivery. So these are the key areas that we need to concentrate. We have looked at the core areas neglected. Basics, heavily neglected. College of Cardiology has a special course on back to basics. Well attended, everybody appreciates. So basics are forgotten. Medical history is forgotten because history keeps on repeating and there are a lot of lessons to learn from history. Ethics and legal aspects, cost effectiveness, management. We are placed at the top level managers level without any management training. No formal training on management. Personality development. These are few core areas that we will be concentrating over next year. We will use the website to the maximum for information, networking, and problem solving. What information can we give? How many books do we go through to find a drug, management protocol, nomograms, vaccination schedules, investigation cost, anything, you name it? Why can't we have everything that a pediatrician needs, or a medical officer needs, or a nursing officer needs, or a midwife needs through our website? It's for all professionals, medical professionals, allied healthcare professionals, and also for general practice, general public. Networking, we can have a member login, a platform of communication, information about members, and a discussion forum for members in an official manner. Problem solving, there can be clinical discussions through the website, expert opinion, complain about drugs, whistleblowing, or notify outbreaks. All these things can be done and many more. We have already started with discussions with a well-reputed IT company, and they are working on that free of charge. They are not going to charge us, I hope. And whatever we do, there will be always pros and cons. Always. Whatever you do. Online learning, convenience, less cost, less carbon footprint. But there are complaints about less attention, lesser engagement. But all our educational activities during next year, we will try to live stream. Whatever we do, we will live stream. We will try to record, and we will try to have it online, available online for later review, for those who miss the activity. We will try to have a less carbon footprint by minimizing printing, minimize travel, and minimizing wastage. So ladies and gentlemen, next year, 2024-2025, we will change to be better a little bit. We know the process, we know there will be rejections, and we know the audience. With that, I hope we will be able to conclude this mission, and we will be able to achieve what I have spelled out. Why have I spelled out? Because I want every member, even members from the general public, to understand what we are going to do in 2024-2025. So we will walk in the same path, in the same direction. Thank you.
Thank you, sir, for inspiring us with your words, your vision, and addressing a need of the hour of meaningful and cost-effective healthcare for the children in our country. We wish you all the very best and courage needed to make the changes you wish to impart and to achieve your objectives during your tenure of office as the President of Sri Lanka College of Paediatricians.